Welcome to the Gum Guru podcast. Thank you so much for being with us today. I'm Jason Kong alongside Dr. Macon Singletary, and today we are going beyond the surface and talking about what dental x-rays reveal about your oral health. And Dr. Singletary, it's great to see you today. Always a wonderful time having you here in the studio. I'm excited for the conversation today because we've all experienced getting x-rays with the dentist or someone who's checking in on our mouth and our skull, making sure everything is going okay with our teeth. But I don't think we know the extent of what these x-rays can tell you, the professional. So what exactly do you glean from getting an x-ray done?
So much. Jason, it's very important that patients realize that when a dentist says, it's time for x-rays, there are the two kinds of x-rays, the bite wings, which are done every year or so, and a full set, which really should be about 18 x-rays, done every 3 to 5 years. And depending on the person, everybody's different, but we see so many things on the x-rays that we can't see clinically. And the expense is minimal if you catch things early. It's a very simple thing to do, and the exposure, people are concerned about radiation exposure, is minimal. With digital x-rays today, it's just almost minuscule. You get more radiation being outside in the sun 15 minutes than you will with a dental x-ray. So as far as the health concern in terms of the radiation exposure, that should not be a factor. As far as the cost of x-rays, it will far outweigh if they can catch something early on than having to take teeth out because it's too far along.
We want to make sure that we're getting those regularly, and that can be an experience where we've got to make sure that we're not putting those off and making sure that we're showing up at a regular basis to make sure that our medical professionals have that information. So what else are you able to tell us about these x-rays and how they help you do your job?
Well, first of all, decay. We can look in somebody's mouth and things look great. We take out I call it the little medieval torture device, which is the explorer that we use to check for decay. That the first time I went to the dentist, that made me sweat. I ran, but because he hit decay and it hurt. But you don't want to get to that point. But if you stay with regular visits, they'll initially do a clinical exam, and then the periodic x-ray comes in, and on those x-rays, any dark spot that shows up, that's decay. It can be imperfection in the structure of the tooth, and that's why the dentist has to evaluate it. But anything that shows that we can't see clinically will show up on the x-ray that, if it's dark, that's not good. There's something going on. You have to ferret out, what that could be. It can be under a filling. It can be under a crown. We can't see under the crowns. That's the only thing that x-rays can't do. If you have a crown on the tooth, you may have something going under the crown that we can't see. Whenever a crown is done, the dentist will be able to say, I think that might be a problem down the road. The patient could always ask, and it may look good, but when it happens, it'll be like you need a root canal. And that's another aspect of what we see on the x-rays is the tooth structure itself, but also bone around the tooth. 50% of the adult population above the age of 30 has some form of bone loss. 75% above the age of 60. That's gum disease, periodontal disease. It doesn't hurt. You don't know you have a problem. If it hurts, it's like high blood pressure and glaucoma. It's curtains. It's too late. You don't want it to hurt. So, again, these x-rays will show that there's been a change. Does it mean something needs to be done different treatment-wise? Not necessarily. It depends on the clinical appearance. But the bone loss is key to document that over time. Somebody wants an implant. If they lose teeth due to gum disease and bone loss, they're going to lose an implant due to gum disease. And how rapid does it occur? If a 60-year-old comes in for an exam And they say artificial intelligence says we're going to do away with the probe. You can't do away with the probe. You can't tell active inflammation by looking at an X-ray or a cone beam or a photograph. You have to evaluate it, but you can tell past history on an X-ray. And I can look at a patient, and this is very important in terms of interpreting or recommending treatment, because if I have a 60-year-old and there's plaque and calculus all over the place, and they've never been to a periodontist, and they've got just a little bit of bone loss, their what I call pyramid susceptibility is small. It's a high threshold. It takes a lot to be a problem, and they may get away with doing an implant or restorative therapy that's expensive. Yet a 30-year-old that comes in and they have no plaque and they got 50% bone loss around teeth, they didn't know they had, and they're susceptible. And they need to be, unfortunately, their immune system or the bacteria that grows in their mouth is different. And so that information is key. So having a history, saw a patient the other day with an implant. 3 years ago, there was a level of bone, and X-rays taken the other day, millimeter bone loss. There was no bleeding. There was no exudate. It wasn't tender. She didn't know yet she had a problem. But trying to ferret out what's going on, she's a clincher. Trauma brings the implants down. It affects teeth too. And the teeth on either side were mobile. She needs a night guard. The only way we knew it is a problem that we took an X-ray. And it was a routine X-ray that the dentist did, then I took another one just to confirm it. So it's important to stay up on it, even though it may not be pain, even though a person may not know there's something going on. We're looking for infection, abscesses. People have root canals, and they can have a cyst at the apex of the tooth that's stable. X-rays over time say that. But if it's new, then something has to be done, has to be retreated. So infection that's in the bone that, again, people can't see. Had an individual not long ago that refused X-rays. We haven't signed a consent. They don't want to do X-rays. Finally, we got X-rays. And on the lower jaw, in between the two premolars, was a cyst the size of a quarter. It turned out to be benign, but she didn't know she had a problem. And so these things can crop up, and left unattended destroys bone. Yes, they can be cancer. They can be osteosarcoma. They're things that we see. They can be autoimmune issues that are seen, Paget's disease. Those things that show up on the X-rays that, again, patient may not know what's going on. So there is so much that we can see. Impacted teeth. Just because they're impacted doesn't mean they need to be removed, but is there a cyst around it? So over time we can tell if there's an issue. Root damage, resorption. People have had orthodontic therapy. 20 years later, they're getting root resorption. Again, they don't know it. Tumors and cysts. All these things will show up on the X-ray that you can't see clinically.
Yeah, it's funny during this conversation, I've thought about all the times that I've gotten X-rays done, but and the information that might be able to tell a medical professional, but for whatever reason, I've just never connected the dots between how helpful it would be to have that history of X-rays to review regularly, so that you can, as a professional, see any sort of changes that might be happening over time. And that really goes to the importance of having a relationship with your healthcare providers and making sure that you have someone that you trust and you have confidence in, because that seems like it would make a world of difference in this situation.
Yes, yeah, definitely. And even if for young people where they are in the mixed dentition, having some people are concerned about X-rays when you're younger. It will help determine the pattern of growth between primary and secondary teeth. It can be headed off at the pass in terms of selected extractions of baby teeth to allow the adult teeth to come in a better fashion. So getting X-rays early on will help probably prevent significant orthodontic bills down the road if caught early enough.
Very good. And in terms of our action step for today, what can we do if X-rays are something that maybe we've put off or we're concerned about?
Yeah, just contact your dentist or periodontist. Make sure that they have an update set of X-rays. As I said, bite wings are like 2 on each side to show the crown part of the teeth. They should be vertical in nature. The dentist will know what that means. Or a full set, and just make sure that the dentist stays on top of it. They will, but if they have a question, they should, get a dental visit. Everybody should be getting a dental visit twice a year, and during those visits, they'll clean teeth, they'll check the periodontal health, and they'll determine there's decay, and then the need for X-rays.
Well, that's an easy step that we can take, and making sure we are getting those regular visits really is key to making sure that we're keeping a healthy track record, and we have a professional who can catch some of these potential threats to our health. Well, that is going to do it for this episode. On behalf of Dr. Macon Singletary, I'm Jason Kong, thanking you so much for listening to The Gum Guru.
If you would like to know more about ways to make sure your smile is healthy, or more information on any of the treatments in today's discussion, check out their website at northraleighperio.com. If you have other questions you'd like to have answered on the Gum Guru podcast, send them to contact@northraleighperio.com.